Hello everyone, welcome to Pharmacology Further podcast. And this time we're going to talk about Pharmacology Further e-newsletter February 2025. So without any delay, let's get started. The first section is Pharmacology difficult? And the subsection we're going to talk about is FDA approved drugs in February. So we have quite a long list of drugs. And the first one in my list is epomorphine hydrochloride. The brand name is Onapgo. It's a subcutaneous infusion device. It was newly approved by FDA on February 3, 2025. It acts like a dopaminergic agonist. It is helpful in treating motor fluctuations, that is OFF, off episodes associated with Parkinson's disease. The second drug on my list is mirdametinib. The brand name is Gomekli. These capsules and tablets, they were approved on February 11, 2025 for the treatment of neurofibromatosis associated with plexiform neurofibromas, that is capital NF1-PN. It is a capital MEK inhibitor. The next drug on my list is vimseltinib. The brand name is Romvimza. These capsules were approved on February 14, 2025 for the treatment of tenosynovial giant cell tumors. The mechanism involved is the switch control kinase inhibition of colony stimulating factor 1 receptor, that is abbreviated as capital CSF1R. The next drug on my list is Kenodiol. The brand name is Texli. It was approved on FDA on February 21, 2025 for the treatment of cerebrotendinous xanthomatosis. It's a synthetically made form of bile acid, quinodeoxycholic acid. I'm sure you might be familiar with this name of bile acid. The next drug on my list is copper intrauterine system. The brand name is Mayutela. It was approved by FDA on February 24, 2025 for the birth control mechanism in women. It would be able to prevent pregnancy in reproductive aged females for up to 3 years. And the last drug on my list is denosumab BMWO. The brand name is Stoboclo. This injection was approved by FDA on February 28, 2025 for the treatment of osteoporosis. And the mechanism involved is inhibition of the capital RANK, that is rank ligand, abbreviated as capital RANKL. Now let's go to our next section, that is the latest medical updates. Well, we have few to tell you, which I chose from the most trusted authentic sites, and this information is derived from internet. So these are the chosen updates that I want to share with all of you that really are quite informative and interesting. The first one on my list is a revolutionary tool was recently launched by US FDA, namely Chemical Contaminants Transparency Tool. The abbreviation is capital CCT tool. It is designed in the manner of an online searchable database. It can easily detect and analyze the health risk of contaminants found in the food. Isn't this so interesting? Well, the next information I want to share with all of you is the American College of Physicians, capital ACP, has issued a guideline stating treatment of episodic acute migraine headache in the OPD settings, that is outpatient settings. Non-pregnant adults who do not respond adequately to non-steroidal anti-inflammatory drugs, that is NSAIDs, should be additionally given triptans. Next information, very interesting one is recent studies in JAMA, that is capital JAMA Cardiology Journal, suggest that food insecurities in general masses, owing to financial and socio-demographic conditions, can lead to higher incidences of cardiovascular diseases events, that is capital CVD events. And what about the next knowledge bite? With sudden rise of measles cases in USA, people try to rely upon vitamin A supplements as a wonderful cure. But research states that vitamin A supplements can help cure the deficiency caused during the ailment, but still, the best resort to trust is the vaccination. Next knowledge bite. In recent researches, there was found no association of either white or red wine with increasing incidences of cancer. Rather, red wine may help in decreasing cancer risks in certain cases. While in one of the cohort studies, white wine was kind of associated with more cancer risks. So this is a quite informative knowledge bite. Next info bite. Capital GLP-1 receptor agonists like tirzepatide was originally designed to treat type 2 diabetes. That is a well-known fact. But from certain time it has aided in the weight loss in many people and is rather used for weight loss. Latest study reports that medication containing tirzepatide has promoted weight loss in non-diabetic individuals also. Study has been included in journal Diabetes and Metabolism. So what the future holds, we don't know, but these are very interesting and quite revolutionary knowledge bites. Let's move to our next section from my classroom. In this section, I share some insights of pharmacology learnings from the classes I have taken this month. And since I was on a holiday this month, so I would be talking about all that I have read this month. My own reading topic comprises of dengue fever and its treatment. Dengue fever is caused when a mosquito infected with dengue virus bites an individual. The signs and symptoms vary from mild flu-like symptoms to very severe dengue hemorrhagic fever. Second time infection is even more serious, so one should be very cautious about it. There are 4 types of dengue viruses, capital D, E, and V, which can actually infect the mosquito. This illness does not spread from one person to another unless a woman is pregnant who can transfer it to the child in the womb. Serious infective states are seen in children, elderly, and in second time infected people. Else, the infection stays quite mild. As per studies, many people get infected every year, but more than half of them hardly show any signs and symptoms. As far as development of immunity is concerned, once a person gets infected, antibodies to the specific strain they are formed inside the body. But we know there are 4 strains of viruses, so the immunity development is quite complicated. Main signs and symptoms are very high fever, pain behind the eyes, nausea, vomiting, muscle and joint pain. Severe dengue hemorrhagic fever begins around 1 to 2 days after the normal fever fades away. Signs and symptoms include stomach pain, nosebleeds, blood and stool, vomiting, gum bleeds, etc. Mechanism is a virus. It multiplies inside the body, harms the blood cells. It forms clots, which can finally affect the blood vessels. Blood leaks from the vessels and it leads to internal bleeding. Dengue is spread by the Aedes mosquito. The diagnostic test is the blood test. Management involves drinking of plenty of water, good amount of rest, painkillers, except, mind it, and take care of this, never to take ibuprofen and aspirin as they can enhance the internal bleeding. Preventive measures include use of insect repellents, mosquito nets, cover on the doors, avoiding standing waters. 2 vaccines they are being developed. One is available in USA. They are generally for kids. Sometimes they are used for adults also. Normally, dengue lasts from 3 to 7 days. If severe hemorrhagic fever develops, patient needs to be admitted into emergency care or medical care facility. So that's all about dengue. That's a great information everybody should know, since it's a seasonal problem and it really affects, it affects large masses of people. That's all in this pharmacology difficult section. What's next? We're gonna talk about the writing part, the Radgin Wiz section. And from my Radgin Wiz writing desk, today I'm gonna talk about benefits of writing regularly. Yes, what are the benefits of writing regularly? First and foremost, I will talk about the benefits of writing regularly or at short intervals. It keeps your mind fresh and it enhances creativity. It improves your writing skills. It kind of fosters discipline in oneself. It teaches the quality of consistency to one's own self. One can self-reflect and improve the communication skills. One enhances the personal growth and the productivity values. It indirectly enhances your knowledge and learning abilities, which you don't even realize. One can try and get their hands easy on the technical part, which is involved with the writing. Writing regularly increases your authority and influence. Your audience is built all by itself without any effort. One, when writes regularly, one manages time effectively and gets a sense of accomplishment. Writing regularly can really create great opportunities at favorable times. Another news, the Kumbh of My Heart, that is a travelogue, diary, journal, whatever you say, is now out for order, and the links is given in the newsletter. Let's quickly jump to the next section about nutrition. Simple and sparkling. Here we're going to talk about this time fluorescent green fennel seeds. Famous as wonderful digestive aid, let us pay heed to the pros and cons of fennel seeds. Fennel seeds, they aid in digestion. They are rich in antioxidants like flavonoids, phenols, essential oils. They possess anti-inflammatory properties and they can really prove very useful in arthritis. They contain phytoestrogens, which can aid in the hormonal balancing, and they are useful in menstrual irregularities and menopausal symptoms also. Fennel water or tea can really act as an expectorant and digestive aid. It can clear the mucus plugs from the respiratory pathway. By helping in appetite control and digestion, it is a very good tool for weight management. Fennel seeds contain fiber, potassium, nitrates, which help to maintain and regulate body blood pressure and support the cardiovascular health. They have ability to fight against bacteria and they promote oral and gut health. Some negative aspects of fennel seeds, which are actually quite ignorable, but they are as follows. On the other hand, it can interfere with the breast cancer too. Why? Because it contains phytoestrogens. If excess is consumed, it can lead to harmful effects during pregnancy. It can very rarely prove to be allergic, and sometimes it can lower the blood sugar, especially when it is consumed in excess. So excess of everything is not good. Avoid it. Sometimes drug interactions can be seen with medicines like blood thinners and hormone therapy because it contains phytoestrogens. I hope that was a great deal of information all about fennel seeds. Some things you knew, some things you did not. Really, do let me know in the comment section. Lastly, our wonderful, most awaited section, Off the Cuff Talks. In Off the Cuff Talks, today we're going to talk about mobile-free meals. Now, what is that? Does this word, if you heard it first time, does it confuse you? It did confuse me. I was associating something with the mobile phone, but it has nothing to do with the mobile phone actually. These are mobile, means moving, free means without any cost, and meals means food. So simple. So let's talk about Mobile-free meals, they can be a game changer. Yes, they can be. It can help in reducing food insecurities. This goal can be accomplished by serving underserved areas where food is scarce. It can be a boon during the crisis and natural disasters and emergency situations. Homeless, widows, school children, low-income people, they can be highly benefited with mobile-free meals. By offering balanced, nutritious meals, it can help to eradicate malnutrition and at the same time educate masses, laymen and general public about healthy food choices. Restaurants etc. can donate surplus food to these services and that can really lead to avoidance of food wastage. Local cultural festivals and traditions can be celebrated with different variety of foods and this can help people come together, supporting unity in diversity. Needy can be targeted and served on time at right location by the use of geolocation technology, AI, that is artificial intelligence, etc. Sustainability and continuity of mobile-free meal services can be ensured and helped by tech-driven crowd-funded raising and sponsorships. By supporting and executing these services properly, community welfare can be strengthened. So these are wonderful services and one should definitely go for support and try to aid and offer and contribute as much as possible. Well, that's all from my end in this spectacular issue of February 2025. Hope you liked it. It satisfied your quest for information, medical updates, and lot of news. Greet you all on the next issue, which is on its way. Please spread the word, subscribe to my newsletter. It would be a great motivation to my efforts. Thank you. Take care. Bye-bye.